News 46. Local coverage you can count on.
At Healthcare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
We have about 7 pharmacists that work in our department, and we work closely with the Southwest Medical Associates clinics and mainly with the primary care physicians. And we're there as a resource for them to help with any medication questions that patients might have, any questions sometimes about coverage or better alternatives, more cost-effective alternatives for our patients.
And so when the public speaks to you, I know you have a booth here about Ask Your Pharmacist, but you actually are there available for the public to speak to you. What's some of the most common questions?
Some of the most common questions would be we do kind of like a brown bag with them where they would bring in their medications and we would go over their regimen to make sure that they are taking them, as they should be taking them. Some need to be taken with or without food. Some medications, even though they can be in the same regimen, can't be taken at the same time together. So just to make sure that our patients are taking them the way they should be taking them to get the most benefit from the medication.
Patients do get concerned about interactions, don't they?
Yes, they do. And so a lot of times the physicians will reach out to us to talk to the patients just to make sure that they fully understand the regimen and how to take them and just to get the best benefit of them.
Do you find that sometimes when people are taking medications, they will self-medicate with older medications or newer medication, but the doctor may not even be aware that they still have those medications on hand? And
yeah, absolutely. That's probably one of the biggest things that patients can do for themselves is to keep a current list of all of their medications that they're actively taking and take it with them when they go to see their physician. To any medications that they're no longer on that have been discontinued or that the therapy is done, that they discard those and get rid of them. The other thing to do is to make sure that you keep a list of all the over-the-counter medications that you're taking or herbal supplements, anything like that, because they can all interact with your prescription medication. So you want to make sure that your providers know all about that.